Hi everyone, my name is Grace and I'm here with my peer Janelle, and we're two fourth-year nursing students from the University of Ottawa. As a part of our community placement practicum, we've been partnered with Care4 to help research and implement a new hand hygiene auditing tool that can be used to audit employees here at Care4 to ensure hand hygiene practices are up to standard, something that is of the utmost priority always, but especially now during the COVID-19 pandemic. Today we are presenting a PowerPoint that details what we found from our research of current practices here at Care4, as well as a tutorial for how to use SpeedyAudit, a hand hygiene auditing application that will be installed on Care4 devices.
Hand hygiene auditing is an important tool that allows for companies and organizations to assess the effectiveness of hand hygiene compliance and best practices of workers in various healthcare environments. At Care4, a need for a more effective and efficient hand hygiene auditing system has been identified so that professional standards can be met, recorded, and analyzed accurately regarding compliance.
This is where SpeedyAudit comes in. SpeedyAudit is a free hand auditing app for mobile devices, phones or tablets, that Care4 is going to implement into practice. This app allows for users to capture the 4 moments of hand hygiene when auditing workers.
This app is downloaded through an app store on Apple devices or the Google Play Store on other devices. The app has been approved for download to Care4 devices by the IT department, and later in our presentation we will discuss what the use of this app will look like.
Here are 4 relevant Accreditation Canada IPAC standards for 2021. 5.6. The effectiveness of activities to promote infection prevention and control are evaluated regularly and improvements are made as needed. 6.2. Clients/residents, families, and visitors are provided with information on how to access hand hygiene resources and personal protective equipment based on risk of infection. 8.1. Hand hygiene education is provided to team members and volunteers. 8.4. Compliance with accepted hand hygiene practices is measured.
Some of you may remember that earlier in September to early October, we sent out a survey on hand hygiene auditing. We sent this survey to 60 people within the organization and got 32 responses back. We did this to assess what practices or tools were currently being used for hand hygiene auditing at Care4 and what you thought about switching to an app. Here's what we learned from you.
When asked how often hand hygiene auditing is occurring in the specific work environment the survey taker manages, the majority said that it wasn't being done because they were unaware it needed to be. Other responses also included that some did not realize observational auditing was a requirement for their environment. Another person wrote that they thought it was a requirement once a year, but that they had not completed it in a while.
We also sent survey questions to home care staff to learn what their practices for hand hygiene were like, since we cannot find a lot of previous home care auditing information recorded at Care4. In regard to how many times home care staff wash their hands using alcohol-based rub or soap and water, the majority of answers indicated that they believed they wash their hands about 10 to 20 times during their entire shift.
To determine if further hand hygiene training might be recommended for supervisors and managers at Care4, we asked what you thought. Majority of respondents agreed that more training would be beneficial.
We also wanted to learn what your opinions are regarding switching to an app for auditing. Most of you answered yes, that you believed using an app would be more efficient.
Here's an example of the current paper tool used for auditing purposes at Care4. When speaking with one of the managers from one of Care4's residential spaces, we discovered that when these tools are being used to audit workers, they are being kept for a short time and then thrown away. They aren't being used to draft reports that Care4 can use to analyze current hand hygiene practices, and there isn't a clear expectation on how often auditing should be done.
Here is where we hope SpeedyAudit can help make a difference. SpeedyAudit comes with many interesting features that can help develop better auditing practices. This app works for an extensive list of healthcare facilities and environments. Through an online portal, audit data can be viewed and made into reports, allowing Care4 to evaluate current hand hygiene practices. Trends and comparative reports from audit data can be used to determine what steps Care4 may need to take to better meet IPAC standards.
So now that we've explained what SpeedyAudit is, I bet you're wondering how it works. We would like to show you a section of this video tutorial on how to use the app, so you can get a better understanding of what your role in the auditing process will be. This video, created by the team at SpeedyAudit, goes through the features of the app and how an auditing scenario would be recorded and evaluated. The full video will be available through the intranet should you need to reference it at any time.
As you can see, SpeedyAudit is an efficient and easy tool to use. At Carefor, there will be one account that will be run by a SpeedyAudit champion who will have access to a main portal where all of the reports created in the app will be sent to the quality team. This champion, in collaboration with the IT team, will create auditor accounts for each manager and site. These accounts will be accessed through a unique username and password for each auditor that will be given to you by the champion. The auditor will then be able to reset their password to something they will be able to remember easily. Should any of the users have any questions while using the app, IT or the SpeedyAudit champion will be their resource for help. SpeedyAudit will be downloaded from the Play Store for auditor use. In regard to pricing, SpeedyAudit charges using a tier system that is based on the target number of opportunities the company has for auditing. It is an annual fee that can be increased should the number of observations being completed require the purchase of a new tier.
Within the app itself, there are also resources should the user have any difficulties. There is an app tutorial that can be accessed at any time, a place to leave feedback for the SpeedyAudit team, and a support center. SpeedyAudit also offers training sessions each month over Zoom. These sessions are 30 minutes long and discuss how to audit using the app.
For those of you who find hard copy resources more helpful, you will be able to print out this quick and easy auditing guide that discusses how to use the app when auditing.
This is available to print as a reference should you need it during the auditing process.
Through the assessment phase of this project, we identified some next steps that Carefor can work to build upon to help meet accreditation standards as an organization. Here they are. First off, each month, new hand hygiene videos and graphics will be uploaded to the internet to help engage employees and remind them of the importance of hand hygiene. We will also have resources surrounding the use of SpeedyAudit and hand hygiene auditing training that will be available on the intranet as well. For home care staff, Carefor leadership will be creating sections on online charting for allied health members and nursing staff where compliance with hand hygiene practices can be ticked off as a yes or a no. In the future, Carefor will develop a system on how often auditing should be done and will develop a process related to where, when, and whom this information will be submitted to.
Thank you very much for listening to our presentation on hand hygiene auditing and the implementation of SpeedyAudit here at Carefor. Please let us know if you have any questions. You can also refer to Diane Roscoe if you think of any questions at a later date. We would like to say thank you to Diane for facilitating our learning throughout the semester.